Distilled spirits and, to a lesser extent, wine deserves serious caution for anyone with gout, elevated uric acid, or a history of recurrent flares, even though they are often perceived as less problematic than beer. The core issue is alcohol itself. Regardless of the source, alcohol interferes with the kidney's ability to excrete uric acid by increasing lactate production, which competes with urate for renal elimination. This means that even without high purine content in the drink, blood uric acid can rise simply because the body is temporarily less able to clear it. In people already prone to hyperuricemia, this effect can be enough to provoke a flare, sometimes within hours or the following day. Distilled spirits such as vodka, whiskey, rum, and gin are particularly risky because they deliver a high dose of alcohol in a relatively small volume. This concentrated alcohol load can sharply suppress uric acid excretion, promote dehydration, and increase oxidative stress, all of which amplify gout risk. Spirits are also commonly consumed quickly and without food, which further worsens their metabolic impact. Even when spirits are mixed with non-alcoholic beverages, the underlying alcohol effect remains, and sugary mixers can add another layer of risk by increasing insulin resistance and uric acid production. For people on urate-lowering therapy, spirits may blunt medication effectiveness and destabilize otherwise controlled uric acid levels. Wine is often described as a safer option, and epidemiological data do suggest it carries a lower gout risk than beer. However, lower risk does not mean no risk. Wine still contains alcohol and can still impair uric acid clearance, especially when consumed regularly or in quantities beyond one small serving. Individual responses vary widely. Some people with gout tolerate occasional wine without obvious problems, while others experience flares even after modest intake. Sweet wines and larger pours may be more problematic, and wine consumed during periods of stress, dehydration, illness, or dietary excess is more likely to trigger symptoms. Another overlooked issue is hydration. Alcohol is mildly diuretic, promoting fluid loss and concentrating uric acid in the blood. Even mild dehydration can increase crystal formation in joints, setting the stage for an acute gout attack. This risk is compounded during hot weather, physical activity, or travel, when fluid balance is already challenged. Alcohol also tends to disrupt sleep and appetite regulation, indirectly increasing inflammation and worsening overall metabolic control. From a nutritional standpoint, distilled spirits and wine offer no meaningful health benefits for gout management. They provide empty calories, displace nutrient-dense foods, and can contribute to weight gain over time, which itself is a major risk factor for elevated uric acid. Alcohol can also interact negatively with medications commonly prescribed for gout and related conditions, increasing side effects or reducing adherence to treatment plans. Practically speaking, for people with active gout, frequent flares, high uric acid levels, kidney disease, or cardiovascular risk, limiting or avoiding alcohol altogether is the safest strategy. During acute flares, alcohol should be strictly avoided, as it can prolong attacks and intensify pain. If alcohol is consumed at all during stable periods, intake should be infrequent, limited to very small amounts, accompanied by food, and balanced with adequate hydration. Any safe level is highly individual, and assumptions based on general guidelines can be misleading. Ultimately, distilled spirits and wine should be viewed not as neutral lifestyle choices, but as potential triggers that can undermine long-term urate control. Discussing alcohol use openly with a healthcare provider is essential, especially when gout is recurrent or difficult to manage. For many people, reducing or eliminating alcohol leads to fewer flares, better medication response, and more stable uric acid levels, making it one of the most impactful dietary changes for gout prevention and long-term joint health.